Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Kawasaki disease. Kawasaki disease is an acute, febrile, usually self-limited illness of infancy and childhood, associated with an inflammation of the coronary arteries. The coronary artery supplies the wall of the heart like the myocardium. And due to inflammation of the coronary arteries, there may be coronary aneurysm. Aneurysm is the abnormal dilation of the blood vessel, and there may be coronary thrombosis. Other medium and large size arteries may be involved less commonly, but may be involved in case of COVID-19 infection. Okay. So in that condition, even the aorta may be involved. Most of the patients are 1 to 5 years of age, maybe from East European descent, but it is now a problem of the globe. If also American Kawasaki disease, not necessarily a child from Japan or that of the Korea or the Eastern China. No, it is a global disease, but more common among the East Asian or the Japanese population. Exact cause is not known. Genetics may play a role. Also, some type of viral infection, it may be non-specific virus, may play a role. It is suspected that vasculitis is a delayed type of hypersensitivity response against vascular antigens. Those are present in the endothelium and also in the smooth muscle of the medium-sized blood vessel like that of the coronary arteries. Subsequent cytokine release and B lymphocyte activation results in antibodies against the endothelial cell and vascular smooth muscles. So, it's because there will be damage to the endothelial cell and vascular smooth muscle, there will be chance of abnormal dilation of the coronary artery that lead to aneurysm. Even it may go to the size of 8 to 9 millimeter, that may be ruptured, that may lead to myocardial infarction, or the aneurysm area and the blood vessel wall may be blocked by thrombosis. That may also lead to myocardial infarction, heart failure, and death. Okay, we got that. On to the next slide. Clinical feature and pathogenesis. Kawasaki disease is an important cause of acquired heart disease of children. Patients are very irritative and fussy because they may have also joint pain, they have fever, they are exhausted, fever persists more than 5 days, bilateral, and this fever does not respond to Tylenol or paracetamol. Even in children, in our management, it is treated with aspirin, this fever, although there is chance of Ray's syndrome, that is the hepatic encephalopathy. Still, aspirin is used to cover the fever to relieve the fever of the patient. Bilateral conjunctivitis without exudate, it is conjunctivitis, red eye, the conjunctiva. The limbus area, junction between the cornea and sclera, is usually not involved in that conjunctivitis. Rash on all over the body and different shape and size of rashes. Oral erythema, red color. Mouth, lip, there may be cracked lip, and tongue looks like strawberry. Okay. Erythema and blistering of the palm and sole is also possible. so the skin may peel out eventually. Cervical lymphadenopathy, specifically or most commonly the anterior cervical lymph nodes are enlarged. About 25% of patients may develop coronary artery aneurysm. Okay, without treatment, there may be 25% patient. If you treat initially, then it may be 4 to 5%. Okay, these are some of the clinical features will be concerned with the heart. This is the coronary artery branches, and we are getting abnormal dilatation of the coronary artery. This is called aneurysm, abnormal dilation of the, because of damage to the endothelium, damage to the myocardium, okay, and the wall of the blood vessel become thinned out, and it may be ballooned out like this. That may lead to aneurysm formation. It may be multiple, maybe very large, like maybe 8 millimeter, that may rupture, or it may be blocked by thrombosis. That may also cause myocardial infarction. Okay, so the wall of the heart wall may be necrosed or damaged. Okay, and the papillary muscle may not work, choroid tendon may not work. There may be regurgitation, dysrhythmia that may happen is a manifestation of heart involvement, rash all over the body. This is the rash all over the body. Okay, and there will be even the palm and sole erythematous. There may be peeled out of skin eventually after 2 or 3 weeks. Okay, that may happen. Okay, clinical feature of Kawasaki disease, again conjunctivitis. Usually the limbus area just after the corneoscleral junction, this area is not involved, but this entire part is involved. Okay, this part there may be halo of white, but almost all conjunctiva is involved. There will be strawberry tongue and the cracked lip. There may be rash over the body, also around the scrotum and perineum. Okay, so there may be some type of scrotum, some type of rash is may present here, mostly here, but it may be present everywhere of the body. And there may be peeled out blister formation of the palm. Okay, so the palm may be red, there may be just blister formation, there may be eventually the skin may peel out. Okay, around the perineum we'll get the rashes also. In addition to the body rashes, there may be blister formation. There may be joint involvement. There may be arthritis along with Kawasaki disease. Clinical manifestation and diagnosis. Clinical manifestation during the acute stage, initial week. Okay, then we'll get fever, arthritis, joint pain. It usually happens second week. Okay, cardiovascular, skin red, palm, sole, discoloration. There may be peeled out of skin. Nail changes happen eventually. Lip and conjunctiva initially involved. Cervical lymphadenopathy, usually the anterior group of cervical lymph node. Thrombocytosis is also associated with that of the Kawasaki disease, along with anemia, leukopenia. Okay, that may happen, but there will be thrombocytosis. Okay, so this is the week here, and this image has been taken from Wikimedia Creative Commons. So acute stage, subacute stage, and convalescence stage. During that time, there will be nail changes. How can I diagnose this patient? Laboratory test, complete blood count. Again, we'll see anemia, leukopenia, thrombocytosis. Liver function test, yes, there may be elevated enzyme level, but the albumin level is low, plasma albumin level. ES are very high, maybe 50 to 60 millimeter per first hour. There will be high level of C-reactive protein. So these two are very important. Plus liver function test and complete blood count. Urine analysis shows the sterile pyuria. There will be no inflammatory sign, but there may be leukocyte in the urine. That that will not cause any pus formation. That is the sterile pyuria, like that of the conjunctivitis. There is no pus in the conjunctiva, just there will be irritation and redness of the conjunctiva. Imaging study, echocardiography, coronary angiogram. Okay, there may be MRI, CT scan, and ECG. Okay, so these all are important. ECG because there may be chance of arrhythmia. Okay, due to myocardial infarction. Okay, that may happen. Okay, so treatment, intravenous immunoglobulin is a treatment that will subside the inflammation. Also, aspirin is very important, prevent thrombosis. And some authors also like to use steroid because some autoimmune mechanism work here. And always there should be periodic follow-up. Usually there is no chance of recurrence, but it may be possible. Okay, and this is the Kawasaki motorcycle and Kawasaki disease. It is linked to Japan, but it is not confined to Japan. American children, European children, Asian children other than Japan also may suffer from Kawasaki disease. And we will remember crash and burn. Suppose this Kawasaki motorcycle has been crashed and there may be fire formation or there may be fire. So just remember crash and burn. Mnemonic I took from multiple sources. C for conjunctivitis, red color, but not close to the limbus. Rash, different type of rash, entire body, maybe in the perineum, maybe around the scrotum. Adenopathy, most likely the cervical lymphadenopathy, anterior cervical lymphadenopathy, skin changes, red erythema, there may be blister formation, there may be also peeled out of the discommotion or peeled out of the skin. Hand and foot, we have found that there will be blister formation and peeling out of the skin. Burn, fever for more than 5 days, there is burn. Suppose this motorcycle is hitting something, there will be something setting fire. Okay. And that's all about the Kawasaki disease. If you have any question, please feel free to ask me. Please share the information with your friends and please subscribe me. Have a nice, wonderful and blessed day. Bye now.